Lauren. My name is Dr. Navona, and I'm a practicing pediatrician in Atlanta, Georgia. I've been practicing pediatrics for over 25 years, and it's just really been an honor for me to work with your mom at the advanced clinician program with Yulin. Okay, you got a great mom. Let me tell you that. She's wonderful. So I'd like to sort of tell you a little bit about my background. First of all, I trained at Emory University, which is one of the most prestigious schools here in Atlanta. So I'm board certified in pediatrics, and I had the opportunity to kind of be out of the country for about 5 years, and I was doing some medical missionary work in Africa. And the thing that really struck me is when I came back into this country, I saw so much children with autism, psychiatric problems, digestive problems, I was just floored, you know. And so the thing that I noticed most was that there had been an increase in the number of vaccines that were being recommended for pediatric patients. As you know, I've been in this business for over almost 30 years, so I'm kind of old. So when I left the country, you know, the things that were recommended sort of was a routine DPT, you know, maybe a polio vaccine, and that was about it. And of course, hepatitis B in the nursery. And now they have at least 5 or 6 other vaccines that are recommended for children that are only 2 months of age. And we all know that their brain is developing, their immune system is developing. So you have to start to question, you know, what's been the big difference that have made these things really be on the rise. When I left out the country, when I was training med school, I mean, we were even told it's unlikely that you're going to see an autistic child. It's unlikely that you're going to see children with these kind of behavior extremes that should be rare in your practice. Now it's almost common. It's almost common, and that's unfortunate. The other thing that we were told in medical school was that, you know, like when it comes to these 2, 4, and 6 month visits, the vaccines are the only way to sort of make parents come in because they want you to do something. We always knew that it was not really the best thing for the children because your immune system really can't even adapt to those kind of adaptogens that early on. But it was a way to get parents in. So the first thing that I started to do in my practice was to advise parents like, hey, take your time and think about it. This 2, 4, and 6 month schedule was not developed with your child's best interest in mind. It was for my benefit. It was to get you in the office and get you on a routine of coming. And now I still want people to come because I think it's important for us to set those milestones, but we don't have to use fear and things that are not good for children to do that. And so there are a lot of good books about vaccines. There are a lot of good websites. There's a website called drtenpenny.com with a vaccine library. There's a book called The Vaccine Guide. There's a new movie out called Bought that gives you a lot of insight into whether this is the best thing for your child. So just think about it. You know, if someone told you, you know, they wanted to do a spinal tap or they wanted your child on, you know, a really strong medication, you would want some rationale for it. You would want to see the insert for the medication. You would want a informed consent. And vaccines are being done every day without informed consent. I mean, just like it's just routine and nothing toxic is going into your child. So if I can be of any other assistance, let me know. I love your mom. Bye.
Thank you, Doc.